Hey, Jody and I just wanted to talk to you a little bit about breast augmentation. So if you don't know what a breast implant looks like, this is a breast implant. It's one of the things we would talk to you about if you decided to come in and consider a breast augmentation. So initially, to make your appointment, probably the first person you would talk to is Jody. And Jody is our patient coordinator.
So generally what we like to do is when you are on the schedule, I would like to call and talk with each individual personally just to kind of get an idea of what you're coming in for, the goals. And then once you come in, we'll go over different types of implants. We will talk with you about where the incision placement is. A lot of questions come up about how much time are you going to be in recovery? How much time will I need off work? Do I need a breast lift? Some of those common questions come up that Dr. Welch will discuss with you in the initial consultation. She'll go in more detail with you one-on-one based on you and what your goals are.
And then once we talk to you and answer some basic questions, obviously one of the most important things is I have to examine you. And once I look at you, I can start talking to you about whether or not you're the best candidate for a silicone gel implant, or maybe a saline implant would be best for you. And there's lots of different options that we can talk about. And then I'll look at you and also tell you whether or not I think you might need a lift, and what a lift means, and what kind of scars and incisions those might mean. And then if you do decide that you want to pursue a breast augmentation, then typically we'll have you come back for a second visit, because we really want to make sure that we understand what your goals are, what you want to look like, and we actually have you try the implants on.
We have a sizing unit that we use, has a series of different sizes. We have you bring certain bras, tank tops, t-shirts, so you can kind of get a good idea of what you look like with those inserts put in.
And we have actually made the choice not to use videography or a screen or a computer program to show you what you might look like. We actually want you to feel what your body's going to feel like when you have these implants in, and that's why we want you to come in for that second visit, so we can really understand what your expectations are. If you have any questions, please don't hesitate to call. Like I said, Jody was more than happy to talk to you. She can answer a lot of your questions even before you come in.